Yeah.
Thanks.
All right. So thank you guys for joining us tonight. If you guys will look over on the left-hand side of the screen and mute your microphones. So we are going to be doing some question and answer tonight, but that's going to be at the end of the session. But anything you say in the background, any background noise is going to get recorded. As we go through the tutorial tonight, we're going to do about an hour of instruction. If you guys can, at the end of that, we'll have about 30 minutes of question and answer. If you think of questions along the way, if you can type them over in the chat section, there's a little bar on the bottom that says chat. You can type them in there and I'll answer them then. Otherwise, we will get started here. So if you happen to have a Dolphin Neurostim handy, please do grab it and we will start going through this. So we have 3 things we need to do tonight. We need to talk about how to operate this. We need to talk about how to find acupuncture points and use it for protocols, as well as how to treat scars and also how to hook up your vagus nerve stimulation kits. So we got a lot of ground to cover tonight. So this is recorded and you will get a link tomorrow in your email and you can watch this as many times as you like. On top of that, you're also going to get an invitation in your email to join our Facebook forum. If you do that, it's a great place to ask questions and see what other people are doing with this modality. And those of us who teach this stuff do get online and answer questions for you guys. And also, you will be able to get information on up and coming seminars we may have and anything that's going on in the world of microcurrent therapy. So without further ado, if you have a Dolphin Neurostim, please do grab it. And we're going to start at the beginning here. And if you look at the tip of the unit right here, you have a, let's see if I can get it in focus for you guys. You have a biocompatible tip. If you push on it, you'll see that it is spring loaded, so it doesn't poke holes in your skin. Because it is spring loaded, we do ask that when you clean these, don't pour liquid down in there because there's a conductive medium that helps this work. And if you get alcohol or any other cleaning fluid down in there, it can actually cause some corrosion. So just use a regular alcohol wipe to clean the tip of the unit with between uses. So I just recommend getting these little pads. You can grab them at the drugstore in boxes. Just clean your tip off, clean the pad on the back off, clean your buttons off, and you should be good to go. Up from there, there is a black button. When the device is on, if you hold that button down, it will do treatments. And when you let the button up, the treatment stops. And you'll notice nothing is happening right now because the device is off, which brings me to the next feature, which is this roller switch right here. So this roller switch is your on and off switch, but it also serves to turn on your battery check light to see if your battery is good, and also turns on the feature on the device that allows you to find myofascial trigger points, acupuncture points, and motor points. So if we turn this on, you'll notice that you can roll it quite a bit in either direction. So that allows you to adjust the overall output and the intensity of the unit. When I turn it on, if I flip the device over, you should see a bright green light here on the Dolphin Neurostim. If you do not see that, that is your indicator that you need to change the battery. And you will notice there is not a bright green light here. So if I turn this one on, you'll see there is a nice shiny green light right there. So this is what you want to see. If you happen to see this, that tells you it's time to change the battery. So we're going to use this opportunity to teach you how to change the batteries on the Dolphin Neurostim. And if you look on the back, there are 2 little holes on the back. Each of those holes has a Phillips head screwdriver, has a Phillips head screw in it. Please do not remove these screws. If you remove these screws and try to take the unit apart to change your battery, pieces fall out, you void your warranty, you have to send it back in, we have to put it back together for you. There's a very convenient battery door right here. And I know it sounds silly, but a lot of people miss that. So it's really easy to open. You just need a screwdriver or a coin or a pocket knife, and you're just going to pry this door off. And when you open it up, you'll see there is a standard 9-volt battery in there. We do recommend 3 different types of batteries for these devices. We recommend Duracell batteries, we recommend Energizer batteries, and we also recommend Panasonic batteries. Those are the only 3 batteries we recommend right now. If you start playing around with 9-volt batteries, what you will find out is they are not all the same size. AA batteries are, C batteries are, D batteries are, all the rest of the batteries are the same size, except for 9-volt batteries. Some are a little shorter, some are a little bit longer. So if you get A 9-volt battery that's too short, it's going to rattle back and forth inside your Dolphin Neurostim, and it's going to connect and disconnect. So you're going to get intermittent contacts, and it's going to affect your overall treatments. If you get a battery that's too long, when you try and push it down in here, you can actually break up. There's a post down in here that holds part of this together. So if you break that, you're going to have some difficulties. So to change your battery, you're just going to give it a sharp little slap, pull your 9-volt battery out, and you'll see that this one is a Panasonic. And I do have another Panasonic battery I can put in here. And then when you go to put your battery plate back on, cover plate, it's going to have a sharp snap. It sounds like it'll break, but it's not going to break. When you turn the device on, you should see a nice shiny green light. So now we know we are ready to go. If you do play around with any other 9-volt batteries with this device, I would urge you to stay away from cheap batteries. They have a tendency to dump all of their voltage at once, and you can actually damage the equipment, the circuit board inside the device. So please do stay away from those. So once the device is on and you're holding it, you can adjust the intensity with your finger. And when you are ready to treat, you can hold down this black button. And then when you hold down the black button, you'll hear a beeping sound. If the device is not in contact with your skin, you'll probably see a flashing light. And you'll notice that as soon as I release the button, the flashing stops and the tone stops. So as long as you're holding this button down, you are doing a treatment. If you are not holding that button down, you are not doing a treatment. You're simply looking for points. Okay, let's move up from there. There's a little black button right here. So this little black button, when the device is on, will act as a timer and also as a continuous treatment mode. So when the device is first turned on, it's in what we call search mode, which allows you to find points. If you hold the button down, that's going to allow you to treat points. But if you push this little button, you'll notice that the Dolphin Neurostim goes silent, and you can see that there's a light flashing on there. So it'll stay in this mode for probably about 14 minutes or so. So it's really a timed treatment, and it goes into a silent mode, which is nice because if you're working with kids who have autism or people who are sensitive to sounds, or you just don't want to hear the beeping, it's a nice little feature. But anyway, it'll run for 14 minutes or so. And when that 14 minutes is over, it will go back to what we call search mode, and you'll have a steady green light and a steady tone. So that's really going to come in handy when you're doing your vagus nerve stimulation. I don't use it a lot of other times. Occasionally I use it when I'm treating scars. But for the most part, I use it for vagus nerve stimulation. And you can, again, push it to turn it on, push it again, you turn it off. And then when you look on the back of the unit, you're going to see a oval metal plate right here. This plate is really important in the overall operation of the device. When you are doing a treatment, you have to be in contact with this plate. So your thumb needs to be on this plate. We do not recommend holding the units like this. We do recommend holding them in your hand like you're holding a pencil, so that your thumb is on this plate and the Dolphin Neurostim rests in the crook of your thumb and index finger, so that you can put the heel of your palm down, and it acts as a fulcrum for you to be able to have fine motor control to find points. Otherwise, it becomes very difficult to locate some of these treatment points because some of them are quite small. So there is also a pack of electrodes that comes with the Dolphin Neurostim if you have the vagus nerve stim device, that you can actually put on here and connect to a wire. So in lieu of touching this, you can certainly use those electrodes too, and we'll go over that in a few minutes. Okay, up from there, there is a slider switch that you can see. It says wet, normal, and dry. So this is for the skin type. This device finds acupuncture points, motor points, and trigger points by measuring how conductive your skin is. So the more conductive an area is, the higher the pitch you're going to hear with the Dolphin Neurostim. So let me demonstrate here. So I'm going to look for an acupuncture point here, and I'll show you again how to do this in a minute. And I'm going to turn this around so you can see it. So as I'm looking for an acupuncture point, you'll notice that I should be holding it with my thumb on the plate, but I'm going to turn it around so you can watch what happens. As I'm pulling this across the skin, you can see the light goes out and the pitch goes up. So that actually tells me I'm on a treatment point. But if my skin were really wet, that would be salty water, because that's what sweat is, I would need to push it over to the wet setting. Otherwise, you're going to get false positives when you look for points. So now when I look for points, it's much more difficult to get that light to go out. And I have to be very, very accurate with my point location. And there's the point right there. So for the most part, I recommend keeping the Dolphin Neurostim on the normal setting, unless you happen to be in a place that is really humid, like Florida or down to Georgia, where I am in the summertime. And if you are up north and it's cold, you probably will want this on the dry setting, because most of the people that you end up working with are going to have very dry skin. Also, if you happen to be using this device in a skilled nursing facility or a hospital, people tend to be a lot more dehydrated. And that's another indication for using the dry setting on here. Okay. So up from there, there is a little polarity switch, and you'll see it's marked. There's a minus sign, a plus sign, and a plus minus sign. So this is going to allow you to change the polarity. This device is direct current, and because it's direct current, you can change the polarity. You cannot do that with an alternating current device, and that is a very important thing to be able to do if you want to be able to treat scars, do proper vagus nerve stimulation, and not raise your cortisol levels and tank your heart rate variability. Very, very important. And if you look in the books that come with the device, if you have the vagus nerve book, I'm going to open to a page here, just kind of a random page here. You will see that the points have a minus or plus by them. So that's going to correlate with the polarity here. So when you look in your protocol books, and there's also another book that comes to the Dolphin Neurostim that has a bunch of treatments in it. So we're going to pick one of those out. Let's find one that has some smaller pictures in it or larger pictures. And you can see that each of these has either a minus or a plus. So all the protocol books are actually going to tell you what polarity to use. But if you need to try and figure it out yourself, if you have a protocol that you need to develop because whatever you're trying to treat is not in the book, you can certainly ask a question on the Facebook forum. But if you're trying to figure out what to do, most of the time, if you leave this device in the negative position, that's going to be most of the conditions you treat, because negative is to bring things down. So in acupuncture, things are either excessive or they're deficient. So if you have something that's excessive, and that's most conditions, so asthma attacks, strokes, heart attacks, seizures, nausea, migraine headaches, tummy aches, muscles that are too tight, constipation, diarrhea, like all those are conditions of excess. All those are things that need to come down. There's too much going on there. Now, occasionally you will have a condition where things are deficient. So that might be something like Bell's palsy, where somebody's face is drooping a little bit, and you need to tone the area, to tonify it, to bring up the energy or bring up the muscle tone. So for that, you would use the positive polarity on the device. That also correlates with bringing up energy in acupuncture. So let's say you knew a little bit about Oriental medicine. You had somebody who was adrenally depleted. You might want to tonify their kidney energy, which is their life essence in their adrenals, to bring that energy up for them. And the other setting is this biphasic setting, where the current actually goes, it alternates above and below the baseline. But even though it alternates, it's still direct current because the pattern remains the same. So direct current doesn't change. Alternating current basically always changes. So if you're going to be doing something like scar release, the biphasic channel is going to come in handy for you guys. All right. So that's all the features on the Dolphin Neurostim. And I will say this later, and I'm gonna say it now. So I'm going to repeat myself on this a couple of times. Whenever you turn the Dolphin Neurostim on, look and check to see that you have a nice green light, because that tells you that your battery is good. The only other time that you really want to look at the light on this device is when you're finding points. So when you're looking for a treatment point, then the light on this device is going to go out when you're on the point. After you start doing a treatment, if you start watching the light, it will drive you crazy, because there are some times when the light will flash, there are times when the light won't flash, and that's dependent on how active the point is, how conductive the point is. It depends on how accurate your point location is. It depends on the intensity of the device. Sometimes it depends on the polarity that you've chosen. So all those are factors that will affect whether or not you see this light flashing once you're doing a treatment. So don't pay attention to it. The two times you want to look at the light are when you turn it on and when you're looking for a treatment point. Other than that, do not look at the light unless you just really want to be frustrated, because I can promise you, you can spend tons of time researching it, which I have, and it amounts to nothing. All right, so how do we go about using the Dolphin Neurostim to find treatment points? Well, let's find a protocol here. So I'm going to look in my little protocol book that comes with the Dolphin Neurostim. If I wanted to treat something like, let's see here. Okay, let's say I had digestive pain, like IBS. So we're going to use the Dolphin Neurostim to locate a couple of these points. So we're going to locate this one right here, which is large intestine 4. And then we're going to locate, let's see which one we're going to locate. We're going to locate on the ring finger. We're going to locate a point called triple warmer 1, TW1. All right, so how do we go about doing that? Well, large intestine 4 is called Hoku. It's one of the most commonly used acupuncture points. Most of you have probably heard, hey, if you have a headache, if you just kind of rub in the web between your index finger and your thumb, you can actually affect your headaches. And it actually is an acupuncture point that affects the front of the neck and the face. And it is a good point for headaches. I don't recommend it for migraine headaches, although it will help migraine headaches. In about 50% of the cases, this is a highly sympathetic point, like it's a highly male point. And what will happen is you will get a rebound headache that's worse than the initial headache. So it's great for sinus headaches. It's great for toothaches. It's great for broken noses. It's great for throat pain. Like anything in this area, it's great for. But I would not use it on migraine headaches. So how do we find this point? Well, a lot of people look in this little area right here in the skin part of the web, in the thin part. And if you do that, you're going to miss your acupuncture point. So it's actually a little bit farther up. If you take your hand like this and squeeze your thumb up against your index finger, you'll notice that it makes a little mountain right here. See this little mountain? So that's going to give me the location of my point. And let me get a marker here. So what we'll do is we'll mark this and then we'll test our point location to see how accurate we are. So that's pretty close to where Hoku is. And if I take my finger and squeeze on top of there, it should be quite tender, and it is. So now we're going to use the Dolphin Neurostim. We're going to turn it on. I want to bring, let's say I have a headache, I want to bring that down, or in this case, irritable bowel syndrome, which is what that protocol is. So I'm going to put this on the negative polarity. I'm going to put the skin type on normal because my skin is neither wet nor dry. It's just kind of in the middle. And then I'm going to pull this across the skin. And I'm doing this a little backwards. Normally, I would have my thumb on this metal plate, but I want you guys to be able to see the light. So as I pull this across the skin, so my point location, my dot is off just a little bit, and the Dolphin Neurostim found the point right here. So that's the point I'm going to treat. So I'm going to turn it around so you can watch. And now I'm going to hold this button down. And as I hold this button down, you can hear this beeping. So as long as I'm doing this, I'm actually doing a treatment. So we recommend holding this for about 30 beeps, not 30 seconds, 30 beeps. And that's basically what you need to get a basic treatment in. We do design our protocols so they can be done in 10 to 15 minute segments if you know what you're doing, because a lot of physical therapists and occupational therapists use this device. And when you get into insurance billing and working in hospitals, everything is built in 15-minute segments. So some of these protocols need to happen very quickly in those settings. All right. So that's large intestine 4, which is known as Hoku, the great eliminator. We do not recommend treating this point on people who are pregnant because it is an elimination point. And if you continue to stimulate that point, you might run into some difficulties. I wouldn't get concerned if you're pregnant and do this by accident once, but I wouldn't keep doing it. All right. Next point we're going to find, let me go back to my little digestive IBS protocol here. And there is a point on the ring finger there that's called triple warmer 1, TW1. You can see right up there. So triple warmer is a meridian in acupuncture. In acupuncture, there are a series of energy lines that run through your body. Each of them is named after an organ system of the body. So lung, pericardium, heart, spleen, liver, kidneys, small intestine, large intestine. Half are male, half are female. The male ones are considered to be yang or yang points. And those are ones that are organs you can live without. Your stomach, your large intestines, your gallbladder, your bladder, things that if you take them out, you're probably not going to die right now. And those are anytime you treat on the male meridians, that's to try and get things done. Like if you're trying to release a frozen shoulder, or if you have a stiff neck, or you have a facial headache, those are action points. If you switch over and treat female points, that's going to be the heart, the liver, the lungs, the kidneys, those organs that are so vital for life that nurture you. They're like a mother, they nurture you. And those points are going to be really good for calming things down. So we need things to chill out. You're going to use female points. So the triple warmer meridian doesn't sound like a liver or a heart. Doesn't sound like any organ that we have. So in acupuncture, the triple warmer or triple heater or triple burner, as it's called, regulates the energy between the three body cavities, which is your pure energy, which is the air you breathe, your acquired energy, which is the food you eat, and then your elimination. So it acts as a homeostatic channel, and it's really good for digestive complaints. So that's why it's in our IBS protocol. So to find that, we want to go to the outside corner of this nail. And so not on the nail itself, but in the little angle right there. So if I turn this Dolphin Neurostim on and pull it across my nail, you'll notice that let me turn it around so you can see it. You'll notice that the tone doesn't change and the light does not go off. But when I get over into the skin right there, right at the corner, you'll notice that the light goes out and I got a really high pitch. And it's actually quite tender. And there are a number of points along the fingers and toes known as Jing, Jing-Well, or Ting points. And these points are generally reserved for acute or life-threatening conditions that pertain to the organ. This particular point happens to work very well for IBS. It can interrupt Crohn's disease attacks. It's good for food poisoning and a pretty good point for nausea as well. So that's one of those points that is useful to remember. But if you have any questions about it, it is right here in your book, and you can look it up. So that's sort of the basics of finding acupuncture points. The best advice I can give you when you're looking for points is to go slowly. So if you've just gotten a Dolphin Neurostim, you're probably going to want to play with it for a few days to get your point location down. And it's a pretty easy learning curve. It takes just a day or two of playing with this to figure out your points. So when you are looking for points, the things I recommend are using the heel of your hand as a fulcrum so that you can have fine motor control. You want to use small concentric circles when you're looking for acupuncture points. And those are the same as myofascial trigger points and motor points for all intents and purposes. If you're able to move slowly and carefully, it's very easy to find the points. But if you move around very quickly, you're not going to register the point. You're going to move over the point so quickly that the light's just going to barely flicker and the tone's going to change just a little bit. So I do recommend moving slowly when you do this. The other piece of advice I can give you is don't push too hard when you use this. So when you're looking for points, if you push down on the skin too much, you can actually increase the conductivity of the skin and you'll get a false positive. So let's see if I can do that for you guys so you can see it. So I'm going to pick a place where there's not an acupuncture point right here. And if you watch, if I push really hard, you can see that the light goes out here. But if I just set the device down, the light doesn't go out. So if I push really hard, the light goes out. But if I use just regular pressure, it doesn't. So the big cautionary statement there is always use fairly light pressure when you're looking for points, and certainly don't push too hard, both because of the integrity of your or your patient's skin, and also because it can cause you to register a false positive on your point location, which is not going to be damaging in any way to you. You're just not going to get a very good treatment. If you find that you have a hard time maintaining contact with your patient, so what's going to happen is you're going to touch this metal plate, and then you have to put a hand on your patient's skin somewhere. So if this were a therapist's set of hands and they were treating me, then they would need to put the Dolphin Neurostim down on my skin and then have skin-to-skin contact somewhere. So it could be with the same hand. So they could touch my skin with the same hand they're doing the treatment with, and then touch with the device, or they could put a hand somewhere else and treat a point. Either of those is fine. When you're treating yourself, all you have to do is touch this metal plate. You don't have to put your hands like behind your neck or anything weird like that. So do keep in mind that clothing is a barrier to electrical conductivity. So you can't use this over clothing, and you certainly can't touch skin over clothing. You can occasionally poke the tip of this through the weave of certain clothes, certain blue jeans and certain t-shirts and stuff, but you really need to know where the points are to be able to do that. If you find that you have a hard time maintaining skin-to-skin contact with your patient, there is something you guys can pick up. You can order them online from the company, and it's something that looks like this. It's a dual wristband, and I would put one of these on my arm and then put the other one of these on my patient's arm, and then we are electrically connected. So at that point, I don't have to have skin-to-skin contact with the patient, because electricity can run back through this up into my arm and circulate back into the Dolphin Neurostim through this little plate right here. So that is, I think they're about $20 or $25. You can look on the website. And I find these are useful, especially if you're going to be doing anything up in the head. Like when we get to doing scar treatments, if you're trying to treat scars in the head, these are very, very helpful. Okay. That's the basics of finding acupuncture points, myofascial trigger points, and motor points. All of them are more electrically conductive than the surrounding skin. So if you take an electrician's ohm meter and you run it around your skin, you can find all these points. You just watch the dial on the ohm meter, and when it shows as being highly conductive, that's going to be your treatment point. So this has an ohm meter in it too. This ohm meter just happens to be tied into a light and to a tone instead of a dial. So you don't have to watch a dial waving back and forth, because I've used devices like that a long time ago, and it's very frustrating because it's difficult to see exactly what's going on. Okay, the next thing we need to talk about is scar treatments. Treating scars are one of my absolute favorite things to do. I love teaching workshops on scars. I actually just got done teaching a scar workshop, probably 2 weeks ago. And for a lot of physical therapists and occupational therapists, but this is one of the things you can do at home as well. So why is it you would want to treat a scar? Well, scars can do a number of things. They can be painful. They can restrict range of motion. So if you had a knee replacement, sometimes you'll find you don't get full range of motion back, even though you do all your physical therapy. And you go see the doctor. Doctor says, well, there's a little bit of scar tissue left in there, and you're probably not going to get that range of motion back. But properly done, you can actually release that scar tissue. And let me be clear, when you have scar tissue, whatever you have is there. It's going to be there. It's not going anywhere. The only way to get rid of scar tissue is to actually surgically remove it. And if you remove it surgically, you're going to have more scar tissue. But you can change the overall density of the scar by using microcurrent. When you change the density of the scar, what happens is the scar tissue becomes more pliable. And what you're doing is electrically repolarizing this tissue. So, like I said, scars can be painful, scars can restrict range of motion, and sometimes from a distance. So you could see someone who has something like a restricted range of motion in their shoulder. They can't move their shoulder, but they have a hip replacement scar. And it's not that they have a shoulder problem, but it's almost like somebody's pulling down on their shirt, and their arm can't move because it's pulling from down in here. So you've got tissue that runs through your body that wraps around all your muscles and organs and tendons. It's called fascia. It's laid down in sheets. It's like a big body stocking. And anywhere you have a scar, it can pull at a distance. So I used to do some work in women's health clinics, and I can tell you for sure that C-section scars, hysterectomy scars, and mastectomy scars are all highly correlated with posterior neck pain and low back pain and mid back pain. So treating the scars on this part of your body helps open everything up so that you can be up straight, and it takes all the strain off the muscles in the back. But any scar can actually be involved in those kind of postural dysfunctions. The other things that scars will do, they will block circulation. So you can see a lot of lymphedema after surgeries from some scarring. And it's a useful thing to be able to treat those scars so you free up the lymph vessels to a bit so lymph can pass through that area. Also, you will find that from an acupuncture perspective, scars block energy. So anytime energy gets blocked in acupuncture, that's considered to be bad, and you need to unblock it so the energy circulates properly. And the last thing that scars can do is scars, even though they don't conduct electricity well, scars are very non-conductive to electricity. They can actually harbor a higher resting charge in the surrounding tissue. So normal body tissue has a resting charge of about 80 millivolts. Scars can have a resting charge of up to 1.6 volts. So what that means is the scar's holding extra electricity, and it will hyperstimulate the local sympathetic nerve fibers. Now, your sympathetic nervous system is your fight or flight response, and it controls things like sweating and microcirculation around your skin. And those nerve fibers that are close to the scar will get hyperstimulated if the scar is a positive polarity. And that will actually wind up your sympathetic nervous system. And you will see that it actually will affect things like your heart rate variability, which we'll get into in a few minutes, and will also affect things like your cortisol levels. So, like your stress hormones, because it's winding up your fight or flight response. And as long as your fight or flight response is wound up, your adrenaline will always be running and your cortisol will always be higher. So, if you can electrically repolarize these scars, get them conducting electricity properly, and also not stimulating the local sympathetic nerve fibers, then all that calms down. And occasionally we do see people who have had surgeries who 6 or 8 months later start having anxiety attacks. And if you treat the scar, the anxiety attacks go away. So again, that's the sympathetic nervous system at play. So really, really important to understand how to treat scars. It's a fairly simple procedure. And it works most of the time. So what we know from the science is that if you treat a scar, you will get roughly a 24% reduction in the density of the scar per treatment. And whatever change you get is permanent. So I could do 3 treatments over the course of 3 weeks, and I would get roughly a 75% reduction in the density of the scar. Or I could do 3 treatments over 3 months or 3 years and still get the same outcome. So whatever change you make in the scar sticks. Unless you re-injure that area, it will continue to be released. It works very quickly. My expectations are if you have a painful scar and you do this treatment properly, you should get close to a 50% reduction in your overall level of pain. And if there are range of motion issues, those typically resolve pretty quickly too. So the only thing that seems to take a little bit of time is numbness. So if you have numbness from a scar, it does take a couple of days for those nerves to start firing again. And I would expect to see that march along a little more slowly. So how do we treat a scar? Well, if we're going to treat a scar, we need 2 Dolphin Neurostims. You can't do this with one. You need 2 Dolphin Neurostims. If we try to treat a scar using a standard TENS unit, we run into a couple of problems. One is it's alternating current, so you can't really change the flow of electrons. The other thing is if you were to take a standard TENS unit pad like this and stick it over a scar, so if I had a scar on my hand right here, what happens is the electricity goes around the scar and doesn't go through the scar because electricity always takes a path of least resistance. So using one of these over a scar doesn't work particularly well. And using a standard TENS unit with pads over a scar does not work particularly well. But what we know is if we use 2 separate sources of electricity with you in the middle, so you're holding these 2 little oval pads right here, the mixing of the current is what seems to repolarize the tissue. So basically playing ping pong with electrons back and forth through that scar is what's going to flip the polarity of it. So I'm going to show you how to do this. It's a fairly simple process. So I've got a little blackboard here, or whiteboard, whatever we want to call it. We're going to draw on there a little bit. And one of the scars that ends up being very problematic for people is open heart surgery scars. So we're going to draw a very unhappy man here who has had open heart surgery, and his manifestation of pain is going to be pain in the upper back across the shoulders, and in the middle of the upper back it tends to be excruciating pain. So he's been cut open right here, and this is fairly deep scarring because they've cut him open and then they've taken basically what amounts to a Black & Decker power saw and sawn his sternum in half and then put rib spreaders in there. So when this gets pulled back together, all this gets wired together, and it tends to be a very painful scar, and B, cause a lot of problems back here. So this is the scar we're going to look at for right now. So how do we go about treating this scar? Well, we need to be able to bounce electrons back and forth through this scar tissue. Okay. And the way we're going to do that is by taking 2 Dolphin Neurostims. Now, there are very specific settings you need to use to do this properly. So we're going to put one of these on the negative polarity. Skin type doesn't matter because we're not looking for acupuncture points, so don't pay attention to the bottom slider switch. We just want to pay attention to the top one. The other one we're going to put on a biphasic channel. So we're going to put it on the plus minus. Again, this bottom slider switch doesn't matter. So now what we're doing is when we go along this scar, we have a negative polarity on one side of the scar, and we have this biphasic channel going on the other side of the scar. So we're going to go on either side of the scar. So if each of these were a Dolphin Neurostim, I would want to go on, not on the scar, but as close as I can get to the scar. And I'm going to put the Dolphin Neurostims down right there. I'm not looking for acupuncture points. I'm just going to put them down on the skin, and I'm going to hold the button down for 10 beeps. Once I've got that 10 beeps completed, I'm going to move about a quarter of an inch and do 10 beeps. I'm going to do this all the way down the entire scar. So what I'm doing is I'm just bouncing electrons back and forth through this tissue. When I get to the bottom, what I prefer to do is to switch the Dolphin Neurostims in my hand so the polarities are in different hands, and do the same thing over again, except go up this time. Again, 10 beeps. I try to go between the marks that I used before. So when I get to the top, that's 2 passes, and I'm going to do one more pass. So we're going to flip the Dolphin Neurostims again, start at the top, 10 beeps, 10 beeps, 10 beeps, 10 beeps, 10 beeps, until we've gotten to the bottom. So we've done 3 passes with 10 beeps each. So that's a total of 30 beeps. So once we've completed that, now we've got some electrons that are passing back and forth through this tissue, and it's more conductive than it was. So now we're going to go at either end of the scar, and we're going to hold our Dolphin Neurostims down. And we're going to count out about 10 beeps here. We're going to move in. Let me use a different color. We're going to move in about a quarter of an inch and do 10 beeps. And again, we're going to do this the same thing we did before, except now we are on top of the scar tissue itself. So I'm going to do 3 passes like this, just like I did going up and down, except they're going to pass each other on top of the scar tissue itself. And once I'm done with that, you will have properly completed a basic scar release. Now, there are some questions we need to answer. What if the scar is not a straight scar? What if the scar is something like a steam burn scar? So I've treated a fair number of those. We have some paper mills here where I work. So I've done some workman's comp work. Steam has an awful lot of energy and can really inflict some bad burns on people. So what if you had a scar that looked like this? Well, if you have a scar that looks like this, you're going to go on either side of the scar, and you're going to work your way around the scar like a clock. Again, counting 10 beeps at each point. So you're just going to do 3 complete circuits of the scar, and we're just passing electrons back and forth through this scar tissue. Once we've done that 3 times, we're going to work through the tissue itself. And remember, we have to have some skin-to-skin contact with our patient, so my hand has to be touching bare skin somewhere, or I need to have something like one of these little connector straps. So we're going to work through there, and that's your basic scar release. You will notice visible changes in the scar the first time you treat the scar. You will notice sensory changes in the scar. It should hurt less, and you will generally notice that the tissue feels much softer and more pliable. So when you repolarize this tissue and you reduce the density of the scar, it becomes more pliable. And there is not much else out there that can affect a scar as quickly as microcurrent can. I'm a manual therapist by trade, and I can tell you that manual therapy does a very poor job, excuse me, of releasing scar tissue with any amount of speed. It takes an awfully long time. It takes a lot of treatments to get what you can do with one session of the Dolphin Neurostim. The closest thing that I can see that to mimic what we do is something called neural therapy injections, where you actually inject procaine into the scar. Most of you guys can't do injections. And if you're dealing with really deep abdominal adhesions, so the thing to remember is if you have any abdominal surgery, and I don't care if they suck your gallbladder out through a tube or they make a cut and remove your gallbladder or give you a C-section or whatever, one abdominal surgery, you have an 80 to 85% chance of getting abdominal adhesions. Two abdominal surgeries, it's a 100% chance. And that's scar tissue that grows beyond the boundaries of the scar. So it can wrap around your intestines. It can connect the front of your intestinal wall to, say, your deep hip flexors and cause all kind of problems there. So there are a lot of problems you can get with abdominal adhesions, in addition to the postural part of it where it pulls you forward. So always treat. I would argue we need to treat almost all scars, no matter that, even if they're not painful, even if they're very old. So you can treat a very old scar. I've treated scars that were 50 or 60 years old and gotten great outcomes. I've also treated people who've just had surgery. When my father had knee replacements, I was treating outside the dressing immediately, and they were surprised how quickly he healed up, because when you do this therapy, it increases protein synthesis, it increases cellular membrane transport, and it also increases ATP production by like 400 or 500%. So it's a massive increase in ATP production. ATP is adenosine triphosphate. That's the mitochondrial fuel. So it ramps up the healing process. It's kind of like a turbocharger for healing. I've had some friends who had diabetic ulcers on their feet that would not heal up under wound care, and I was able to treat them and help them out with that. So it's a very effective modality. I would tell you that anything that's an injury, sprained ankle, bruise, whatever, if you treat that like a scar, it's going to help it heal up much faster. So there's a lot you can do with two of these in any area that has recently been injured, or any very old scars too. Those actually respond quite well as well. All right, so that's what we need to talk about with scars. So the next thing we need to talk about is vagus nerve stimulation. First of all, what is the vagus nerve? The vagus nerve is the longest nerve in the body. It is considered to be the wandering nerve. That's what they call it. It starts kind of on either side, back sort of in your brain, back behind your ears, and comes together right here and goes all the way down to your gut. It's the information superhighway between your brain and your gut. More information actually goes from your gut to your brain than goes from your brain to your gut, which is why they often call the vagus nerve the second brain. It has a very strong influence over the sympathetic and parasympathetic nervous system. So properly stimulated, it can calm your system down, it can aid in recovery, and even can modify your overall longevity. So when we do vagus nerve stimulation, you can actually measure the responses physiologically, and we do that with an EKG. And there are a number of measures we can get from an EKG. And the two we're going to concern ourselves with right now are heart rate variability. And if you look that up, you will see there are tons of studies out there on HRV, HRV. So that stands for heart rate variability. And the other one is HFF, which is high frequency vagal tone. So this one is a measure of the overall balance between the sympathetic and parasympathetic nervous system and its total power. So it's your ability to resist injury, disease, stress, and then once you get injured, your ability to recover from those things. This one is your parasympathetic nervous system. So this is your high frequency vagal tone, and that's your ability to recover once you have been injured. Both very important numbers. As a matter of fact, heart rate variability is one of the metrics is actually tied to survival and longevity. So if you look at a graph right here of heart rate variability, this has actually, it's linked to cancer survival. And the higher your heart rate variability is, the longer you are going to survive. The lower it is, the greater your chances are of dying. So what we know is when you are young, your heart rate variability is high. That's when your immune system is at its best and your ability to recover is at its best. As you age, your heart rate variability starts to drop. And heart rate variability is absolutely correlated with longevity. If your heart rate variability is not good, it means you're marching closer to death. That's what it means. So if it gets too low and you get the right insult, sick or wrong nutrition or whatever, it can kill you. If your heart rate variability is higher, and this is not your heartbeat, this is the time variance between beats. So it's a proportional thing. But if your heart rate variability is high, you stand a much better chance of surviving things. So if we look at this graph, these two graphs, we can look over here and we can look at heart rate variability here, and you can see that it drops significantly over time. So by the time you are 40 years old or so, your heart rate variability has dropped by about 50%. If we look at this other graph, this is cortisol, which is runs in correlation with stress, and you will see that as we age, our cortisol tends to go way up. So as heart rate variability goes down, cortisol goes up. So if you can modify those numbers, you can actually live a much healthier life. To tell you how powerful this modality is, when I had COVID and these devices were approved for use in Canada for acute respiratory distress with COVID and for long haul COVID, back when COVID was a concern, these actually had government approval and were used in clinics and hospitals for COVID. When I had COVID myself, I had the Delta variant, and my kids sailed through it. They're in great health, and they were through it in probably three days, maybe 4 days. I got very ill. My oxygen saturation was hanging around about 90%, which is really not all that bad. But then I woke up one morning and my heart and my oxygen saturation was at 80. And when your oxygen saturation gets that low, that can be a trip to the hospital. So I raised 2 children by myself. And my concern was, hey, my kids are going to see me either leave this house in an ambulance or they're going to see me leave this house in a hearse, because I couldn't get out of bed. Like, I was so weak, I couldn't get out of bed. So I had my kids bring me a Dolphin Neurostim and the vagus nerve stimulation hookup. And I did that for about 2 hours. And over the course of that 2 hours, my oxygen saturation went from 80% back up to about 90%. So it was extremely effective for that. Anytime you have any kind of systemic inflammation, so that could be toxic mold syndrome, it could be an autoimmune disorder of some kind, MS or something like that, or go ahead and pick one. Works really well also for autistic kids. It's a great thing to use for anxiety. If you have digestive complaints, it balances your system out. If you are an elite athlete or an athlete at all, you will find if you do this immediately after your workout, it will reset your heart rate variability. So you will actually recover much faster. It staves off delayed onset muscle soreness and can actually keep you from going into overtraining syndrome, which can be not really dangerous, but it requires a lot of rest to recover from, and it interferes with people's training. So if you're an elite athlete, keeping your training schedule up is really good. Now, for me, I'm 53 years old. I raised 2 children by myself. I have since they're now 12 and 14. I've raised them by myself since they were 2 and 4. My life tends to be very full. And when I was 40 years old, that was fine. But at 53, I don't have the energy that I used to have. So I do 10-hour days of therapy. Like, I treat patients from 8 in the morning till 6 at night, and then I take care of kids. And I also travel and teach workshops on how to do this modality. So I tend to get worn down quite a bit. If I do vagus nerve stimulation twice a week for about 30 minutes, it keeps me in a good place. But If I don't, then what ends up happening is that by about Wednesday afternoon, I really start to wind down. My energy level is bad. I get tired all the time. So it makes a big difference in my ability to recover from the stress I put on myself. So if you're just kind of an average person like I am, I would recommend using this a couple of times a week. Now, if you're heavy into athletics, you might use it every day. Or if you're really sick, you might use it for hours a day, depending on what your therapist tells you that you need to do. So, how do we go about hooking up vagus nerve stimulation? Well, if you have the vagus nerve stimulation kit, you're going to have a book like this that has a recovery manual. There is going to be a card like this in there that shows you all the ways you can hook it up. It even shows you how to put the clips on your ear, but I'm going to demonstrate all that for you right now. So the things you're going to need are a Dolphin Neurostim. You're going to need a black cable that comes with it. It looks like this. It has a male connector on one end and a cup connector on the other. And if you look in that cup connector, there's a shiny piece of metal in there. And that shiny piece of metal needs to touch the tip of the Dolphin Neurostim. So you need to make sure you have a nice fit on there. So make sure it's pressed down well. And if I turn the Dolphin Neurostim on, and when I touch this metal plate with this, you'll see the light goes out. So that tells me I have a good connection. Okay. The other thing you're going to need is an ear clip. There are a number of different ear clips that come with the Dolphin Neurostim. There is one that is it's black that has a little metal piece on it. To be honest with you, I don't use these that frequently. My favorite ones to use are these dome electrodes. They look like this. They have a rubbery looking thing on them like this, and they fit very well in your ear where we need to get. So if we're going to properly do vagus nerve stimulation, we need to get as close as we can to the nerve endings of the vagus nerve. And there are two areas of the ear that have the highest concentration of nerve endings for the vagus nerve. There was a recent MRI study that showed this. And so the two places are the inside of the tragus, so this little flappy thing right here. So if you push on that, it kind of closes your ear. That's your tragus. So inside here, so I would take this and take the dome part and put it inside the tragus like this. The problem is a lot of people have a very small tragus and it's difficult to get these clips to stay. So the other place is the upper concha of the ear, which is this area right here. So if you touch the tragus and run your finger back, there's a little hollow back in here. So that's this area right here. That's the other area that works really well for vagus nerve stimulation. And these clips are specifically designed to get into that area. So you can put it in here like this and it will contact that. However, these clips are this little knob on here is conductive rubber. It works best if it's moist. So my recommendation is either take an alcohol wipe and moisten it with an alcohol wipe, or you can use a conductive medium like ultrasound gel. There's something I use, and we don't carry it on the website, but you can. It's called 1020. You can pick it up on Amazon. It's a kind of a goopy substance. You can see it kind of looks like paste or something like that. And you can put a little bit of that on there, and that seems to conduct really well. It's cheap, $10, $20. A jar of it will last you practically forever. Or you could just moisten these with water. But alcohol is not a bad way to go because that is sterilizing. So you want to take this and put it on the male clip. So now we have this set up. There are also some small electrodes in your kit that look like this. They look like a little oval. So I strongly urge you to clean this metal plate before you put them on there. We have these electrodes specially cut to fit the Dolphin Neurostim, which makes them more expensive because they have to be specifically cut for that. So if you clean this thoroughly and get all the oil off of it from your skin and then dry it, you can use these electrodes over and over again. But as soon as this black area on the electrode gets oil on it from your skin, it doesn't stick very well. So it's going to stick quite well now. So I can put this on here like this. And you'll know if I tug on it, it's nice and tight. I can use these over and over and over again because these never go on anybody's skin. They're just going to go on the Dolphin Neurostim. So it's not something you even need to worry about. When you're done with it, if you put it back on the little plastic card it comes with, you can use them over and over again. So there is also a white cable with your kit that looks like this. It has a male connector on one end, and on the other end, it has what looks like a female connector, but if you look inside there, you will see that it is also a male connector, so either end of this will work. You're going to plug one of the ends into the white electrode that is on your Dolphin Neurostim, and you will notice that the cables match up so that the white cable of the electrode matches the white cable here. The black cable coming from the tip matches the black cable of the ear clip. And then you have some packages of electrodes that look like this. And you're going to connect that to the other end of your white cable. So now we have a complete setup. If I were going to test this to see if it worked, to see if I had everything connected properly, if I take this little electrode and I take the ear clip and put it on there, what should happen is the light should go off, because this is essentially the same thing as finding an acupuncture point. I'm completing the circuit, and the pitch of the device should go up. So those are the two things that happen when you find acupuncture points. The light goes off and the pitch of the device goes way up. If you have a good connection with this, it will be the same thing. So I'm going to clean this carefully and get some alcohol on there to act as a conductive medium. I'm going to put it in the upper concha of the ear right here. Then I'm going to take the other electrode, and there are two places, according to our card here, we can put it. I can either put it 4 fingers below my belly button, or I can put it on my wrist. If I put it on my wrist, there are 3 acupuncture points right there, known as the golden triangle in acupuncture. They're parasympathetic calming points, and it's a great place to put the Dolphin Neurostim if you're dealing with a lot of stress. For most of my patients, I do recommend that they put it below their belly button. So I'm going to do that right now. And once I do that, you will see that the light on the Dolphin Neurostim goes off. Now, I'm all connected. So now I'm going to push this little button right here, and the device is going to be silent, and it'll run for about 14 minutes. And at the end of that, it will revert back to this constant tone. So that tells me that the treatment is over. So at that point, I can either take everything off, or I can push this button again and do another round of treatment. So the older devices that we had problems. People would hook themselves up to do vagus nerve stimulation at home, and then they would end up falling asleep with them on, and they would do vagus nerve stimulation for 5 or 6 or more hours. And what would end up happening is they would wake up feeling really groggy the next day. So how often should you do vagus nerve stimulation, and how much should you do? The first treatment, we recommend 5 minutes. That's it. Now, for most people, you're not going to notice a huge difference after 5 minutes, but some people are more sensitive than others. So if you do 5 minutes and you find that it makes you feel very relaxed and calm, that's about as much as you need. What we recommend is adding 5 minutes per day, up to about 30 minutes for your treatment, just to find the right amount of time to calm your system down. And if you're working with a therapist, they can give you guidance on that. If you have questions about that, you can certainly post them on our Facebook forum, and we'll be happy to work with you on that. So once you have it all set up, you can hook it up, you can turn it on, and you can read a book, you can wash dishes, you can do whatever, and it's going to continue to run. It's going to be fine. Now, there are some other ways to hook this up. You could put it on your right ear. So if I put this on my right ear, the left ear tends to bring things down, which is mostly what we want to do. It balances things out, lowers your stress levels, lowers your cortisol levels. If we put it on our right ear, we're going to switch the polarity from negative to positive. So we're going to use that to bring things up. So if your energy is really, really low, you will use a positive polarity on the right ear, and you're going to put your electrode down on your tummy for 5 minutes. We don't recommend doing this before you go to bed at night because a lot of people end up having some insomnia from it winding their systems up. So left ear is fine at nighttime on negative, right ear on positive. I would avoid that in the evenings. You might want to do that like more in the morning. The other thing you can do is if you look in your kit, there is what's called a splitter or a Y wire, and it looks something like, let's see, this. And you will see that there is a female connector on one end and 2 male connectors on it. So if I take the ear clip off of this black cable and connect this splitter cable to it, I can then put an ear clip on each end of it. So I'm going to have 2 different ear clips here. And now I can put an ear clip on my left ear and on my right ear. So why would you want to do that? For basic homeostatic balancing. So if you're just trying to level things out, this is a good way to do it. Now, when you do this, you want to switch the Dolphin Neurostim onto the biphasic setting. So you're going to flip it over on the plus minus setting. So it's going to help move energy or move current up and down the vagus nerve. Now, the left side, the right side does go more up and the left side does go more down. But if you do this, it's going to help kind of circulate the electricity through there for both sides. For the most part, I tend to stick with just using my left ear and negative polarity, but you can experiment with this splitter cable. It does work quite well. But people have different levels of sensitivity for vagus nerve stimulation. So a friend of mine, if he uses a single ear clip, he's fine, left ear or right ear. But if he uses a splitter cable, like he finds it makes him a little bit nauseous. He doesn't feel well afterwards. It doesn't make him sick. He just feels a little queasy. So for him, like left ear, right ear seems to be best. I tend to find my best outcomes with using a single ear clip. But I do know people who respond very well to the splitter wire. That seems to be their thing. So you need to play with it a little bit because the stressors in your life and what's going on in your system, it's a little different from one person to the other. So that's the basics of how to set up and connect vagus nerve stimulation and how to do it. You can certainly purchase more of these electrodes from the company if you need them. There are more ear clips if you need those as well. Other things that you might find useful. Let's see. I forgot to mention this earlier. If you are treating scars, this is a very effective modality for scars. If you use essential oils at all, there is a blend that I do recommend, and it is called Essential Breathe. And it is a roll-on, and it is put together by a guy in Florida. It's called Other Worlds, and the phone number is, let's see here, 95. I'll just put this on the board here for you. Really nice guy. He puts together really, really good essential oils. He has people who put them together for him. Let's see here. 954 654 6427. Let me make sure I got that straight. So the way you would use this is to roll a little bit of this on whatever scar you're treating, and then use the microcurrent over the scar after that. And so the microcurrent will drive the essential oils down into the scar like ontophoresis and can help soften it up even a little bit more. It is certainly not necessary to use this, but I do find this to be a very helpful product, and it's not very expensive. So order one of those up and it'll help you out with your scar treatments. Okay, we need to talk about another accessory that comes with the Dolphin Neurostim, and that is this accessory, which looks like a ballpoint pen connected to a wire. So this fits on the tip of your Dolphin Neurostim. This is flexible, so you can bend it in whatever position you want. You could tape it to a back scratcher, and this is used for treating points you otherwise couldn't get to. So you could use it to treat points on your back. You could use it to treat points if you were working with somebody who didn't want to have the sound in their ear. You could use it to treat ear auricular acupuncture points. It's not designed for internal use, but I do know therapists who use this for scars inside the mouth who do TMJ work. And I also know therapists who use these for episiotomy scars, so that the Dolphin Neurostim is removed from that entire area. These are about $25. If you need to replace them, they're cheap and they're easy to clean. Obviously, if you were using it in someone's mouth or on a episiotomy scar, that you would make them purchase this portion of it. You would need 2 of those, and they would clean them and they would bring them to therapy, and they would just keep them once you were done. So that's something that comes with the device. It is very useful. Things you don't want to do with this device. So let's get into contraindications for a few minutes, and then we're going to take some questions. Don't stick it on top of your head if you have a history of seizures or you're pregnant. Don't treat large intestine 4 if you're pregnant. That don't treat on tops of the shoulders if you are pregnant. That pushes energy down. Don't treat on the inside of the ankles if you are pregnant. There are points that are used to induce labor. Now, if you are pregnant and you want to use this, I do recommend asking your doctor first. I use these in a women's health clinic, and the doctors would order this therapy on patients. But I'm not a doctor, and it was not my decision to make on whether or not to do this. So if you're a therapist, always get the doctor's okay first. Other things you don't want to do with this, I call it the rule of pencils. Don't stick this anywhere you wouldn't stick a pencil. Don't stick it up your nose. Don't stick it in your eye. Don't stick it way down in your ear. Keep it out of deep crevices of your body. Other than that, you should be pretty good. Plates, screws, artificial joints, dorsal column spine stimulators, baclofen pumps, insulin pumps, all those are fine. Those don't pose any problems whatsoever. Don't stick it in an open wound. Again, don't stick any place you wouldn't stick a pencil. You can treat around the wound, but not in the wound. Avoid treating over active cancerous tumors. That is a caution from the FDA. Other cautions, if someone has a pacemaker or a defibrillator, they do recommend that you check with the doctor first. It's not completely prohibited, but it is a caution. So check with the doctor first and see what they say. I have had this therapy ordered before by doctors on patients who had pacemakers and defibrillators, and they seemed to be okay, but that was the doctor's decision, not mine. I think that covers. This is perfectly safe to use on children. I would recommend turning it down because children are smaller. I certainly use this on my kids when they were babies to stop colic and to help them get to sleep at night. I've done workshops for All Children's Hospital down in Tampa. They were using this for Rhineck, for spasmodic torticollis in babies to get their necks freed up. So it is safe. You can also use this on pets. You can use this on dogs. I've used it on dogs, cats, horses, and even treated a donkey once, and they all seem to respond pretty well to it. So that is all of the do's and don'ts of this device. And that is how to do vagus nerve stimulation, how to treat scars, and how to find points. Again, don't forget to check your battery when you turn the device on. Watch the light when you are looking for acupuncture points. When the light goes out and the pitch goes up, so when you hear that high-pitched whine, that tells you you're on a point and the light should go out. And if you're not on the point, the pitch will go up a little bit, but not a lot, and the light won't go out. And once you find the point, the light will go out. And then you're going to push the button down and hold it for about 30 beeps. All right, let's take a few minutes here and go through some questions in our chat section. I see some questions here I need to answer. So we're going to roll through these. Let's see here. Please come to Northern California and teach a scar workshop. Gene, I will be happy to come to Northern California and teach a scar workshop. I actually used to fly out to at the time it was the American Academy of Pain Management. Now I think it's the American Academy of Pain Medicine. And they were headquartered in Sonoma, California. And I used to fly out there and treat their staff. So I love Northern California, up in the Gold Country, and I love it over near Tahoe. So if you can get me a place to do a workshop and get me some people, I will be happy to come out and do it. We also have a therapist who lives in LA who could come up there and teach it. Of course, I would like to fly out to California, but I do live in Georgia. We do have somebody in California. What about scars that are deep inside the joint that you cannot even see and is nowhere near the original scar? I'm thinking of a lumpectomy scar in the breast where they did the biopsies, etc., or in a hip replacement where there's clearly a scar deep in the socket. Okay, great question. So if you can't see the scar, use the Dolphin Neurostim and work around the area where you think the tissue damage is or where the scarring is. The other thing you can do is if you have the vagus nerve stimulation kit, you can put this white wire on it like this. So let's say I was treating a tonsillectomy scar. That's a pretty deep scar, right? So I could take this pad and put it on the back of my neck like this. And then, oh, don't treat on the carotid arteries. Don't push on the carotid arteries. It's not the electricity, it's the pressure. That's another don't. But if I were treating the front of my neck, now I'm bouncing current back and forth through this way, and I'm also pulling the current through my neck. So I'm treating the scar in 3 dimensions. So I could put this on the back of my shoulder, or I could put it on the other side on, let's say, if I was treating the hip joint, I could put this on the inner thigh to draw the current through. If somebody had deep abdominal adhesions, I could stick this on their back and treat over an abdominal surgery scar to pull those electrons down through that scar tissue. So just picture in your mind where you think the issues are and just treat up and down and left and right. So you could basically like pinpoint the area that seems to be problematic and make an X over it and treat that as though it were a scar. So that's a great question. What else have we got here? What's the maximum amount of time that you can perform a single scar treatment? Gosh, I market scar treatments to plastic surgeons because they make scars and their scars actually look really good, but that doesn't mean that sometimes they aren't painful. So a lot of those people have gone in to have facelifts and, um, you know, make their breasts look better, or make their, eyes look better, or whatever they've gone to do. And there are scars there from that. And they have paid cash to have that done to them. So I don't mind charging them some money to make the pain go away from that. When I do those treatments, sometimes I will spend up to an hour. So you can do a scar release very quickly, or you can be very, very uh, detail oriented and spend a lot of time. The more time you spend on a scar, the better it's going to be. So it's all about passing electrons back and forth through that scar. So the more you do that, the better off it is. Now, the caveat is that you need to use microcurrent. So it's got to be low frequency direct current. So it doesn't help you to use a high amount of current to try and blast it through there, because what happens is it may help release a scar, but it will negatively impact your cortisol levels and your heart rate variability. And those are tied to stress and longevity, so that we don't want to mess with that. Let's see here. Can you treat all scars or should you do one at a time? Also, have you seen achiness after an intense scar release session? Yes, you can treat all scars. If you have the time, you can go through all the scars in the body. I know therapists who, before they do anything else, will treat all the scars in a patient's body. You can definitely have achiness after an intensive scar release session, because when you release that fascia, the tissue underneath sometimes hasn't been working. And so now it's got to work, and you'll see some achiness with that. What do I think is the best way to let's see if I can find that one again. What is the best way to check heart rate variability? Sleep Number beds will check your heart rate variability. Polar makes a monitor that you can use to measure heart variability. Aura rings will average your heart rate variability over the course of a day, so you can get an idea of how it is from day to day. So there are a lot of different ways to do that. We use some pretty sophisticated equipment to do that for research, but obviously we're doing research. So there are some ways out there you can do it. There's probably some stuff with both with Android and Apple phones you can use, and you can just track it on a daily basis. And it does vary from morning to night, but so you kind of want an average of what it is depending on how active you are. But it's a lot cheaper and easier to measure it these days than it used to be. All right, what else have we got here? How much is too much usage for the VNS, and can you use it on kids? Yes, my son has attention deficit disorder, and I definitely use it on him. How much is too much? That's really dependent on the person and how sick you are, or how stressed your system is. So if things are not particularly stressful, like once a week for 20 or 30 minutes, if you have like mold toxicity or some severe autoimmune disorder you're trying to balance out, you might be using it every day for upwards of an hour a day, depending on what your therapist says. Can you treat the thyroid, including hypothyroidism, Hashimoto's? Yes, you can treat the thyroid. That actually responds to vagus nerve stimulation. There are specific protocols for that. I don't think they're in the protocol book that comes with the unit, but if you ask a question on the Facebook forum, we can probably get that to you. And you're definitely going to do some treatment in this area. But we have seen people who have used it who seem to get some regulation of their thyroid with this. So that is certainly something you can do. If someone had seizures due to a medication, is it still okay to use this, or is it just the top of the head that's not recommended? So there are acupuncture points that actually stop seizures. So if you have a history of seizures, um, if it's from a medication, I wouldn't worry about it. But even if you have had seizures, you can do treatments, just stay away from the top of the head. And that's contraindicated even with needles. Like in traditional acupuncture, you don't stick needles on the top of the head if there's a history of seizures. If someone has a big scar, is it okay to stop halfway? Yes. If you only have 10 minutes, do 10 minutes of treatment and move along. Whatever progress you made, you will not lose. How often should you treat a scar? So electrically, the scars continue to change for about 48 to 72 hours after a treatment. So the results you get right now will be even better in a day or two. Um, so I would say a couple of times a week. I mean, I've had people who've flown in for treatments and I treated them every day because they were only here for a week. And I've had some people I've treated once a week. I've had people I've treated once a month for scar stuff, and all of them respond quite well. It's just a matter of how much time you have. But there's nothing wrong with doing back-to-back treatments. Um, but you do have to understand that electrically the scar will continue to change after you do the treatment. So sometimes it's best to give it an opportunity to change and for the tissue around it to adapt to what's going on. I have plantar fasciitis and a lump in the arch of my foot, as well as two arthritic toes. Can you treat the painful areas or just the points? Yes, you can treat over any painful area. You can take the Dolphin Neurostim and hold it directly on that point. However, I would point out that with something like plantar fasciitis, treating directly over the area doesn't really give you long-term resolution. They always say you need to stretch your calves out, so they'll have you stand on the stairs and stretch that way. But what you have to ask yourself is, why is the calf? So what happens is the calf tightens up and it pulls on everything along that line. So why is the calf tight? Well, we're going to take a look here at our handy dandy little dermatome chart. And you see there's a poster on the wall behind me, but I've got a little poster here. And I think they still have these on the website. I don't know. They're about $10, something like that. But if you look at the back of the calf, you will see that says S1 and S2. So the back of the calf is innervated by the nerve from the sacrum. So if you have any irritation up in here, that's going to increase the levels of acetylcholine along that pathway. So acetylcholine is a neurotransmitter that makes muscles not spasm, but start to draw. So the more irritation you have in the sacrum, the more your calf muscles are going to tighten up. So when you're doing a plantar fasciitis protocol, it's great to treat over the areas of pain. You can take that Dolphin Neurostim and stick it right on there, and it should help it feel better. But treat your calves and also treat up in your low back around your sacrum, that little triangle of bone at the bottom. Let's see if there's a Let me look at the protocol book here. Let's see what we got. I don't know if plantar fasciitis is in there or not. Let me look. I don't see plantar fasciitis, but I bet, yeah, if you use this protocol right here, calf pain, that is in the book, that is most of the points you need to treat plantar fasciitis. The only thing I would do different there is treat points on the bottom of the foot as well. So that is there and available for you. All right, what else have we got here? Does it matter what order the points are treated in a protocol? Good question. Left to right, up and down. Okay, so in traditional acupuncture, there is definitely a way the needles go in, and there's definitely a way the needles come out. However, you guys aren't acupuncturists, you're using microcurrent. Um, it doesn't really matter the order of the points for most of these protocols. I mean, ideally, sure, there's a way it would happen, but don't get concerned with that right now. We're just concerned that you find the points and treat them. So you could look at a protocol and treat from the bottom of the protocol to the top of the protocol, or start at the top of the page and move to the bottom. Either way is going to be fine. You're going to get outcomes either way. Are there effects of always being part of the circuit? Yes, there are. It boosts your immune system. It boosts your heart rate variability. So it actually kind of works in your favor. So it acts as a homeostatic balancing tool for your system. I tend to get when I get sick, I get really sick. But as a general rule of thumb, I just don't get sick because my immune system is pretty good. And what I've noticed over the years doing this therapy is I used to have terrible allergies. And I don't have allergies anymore. I mean, like the pine trees are going crazy here in South Georgia right now. There's yellow pollen over my car, and I'm just a little bit stuffy. But God, there was a time I would be sneezing, my eyes would be burning. Like that was a daily thing for me. So being a part of that electrical circuit when you're doing this treatment actually works in your favor. Could this help muscular dystrophy? Um, I know that there is a strong genetic component to muscular dystrophy. So my thought would be if you balance the autonomic nervous system out, it should slow the progress of it. So the less stress, like anything, if you have MS, when you get stressed, it accelerates it. When you have cancer, if you get stressed, it accelerates it. So I would assume that with something like muscular dystrophy, the more stress your system is under, the faster it's going to progress. So you'd want to release all the scars on the body because those are stressors. You want to treat all the acupuncture points, like any nerve impingements and stuff, because those are stressors. And if you're particularly interested, we could probably put together a protocol for you. You probably would have to contact the main office and talk with Dr. Bruce, who designed the unit, and he might be able to help you out with a specific protocol for that. Can I use it for trigeminal neuralgia? And if so, how? So this is actually, I spent about 15 years of my career working in neurology and neurosurgery offices, and this is one of the very few modalities that works for trigeminal neuralgia. Trigeminal neuralgia, if you don't know what it is, it's pain in this area that's affected by the trigeminal nerve. They call it the suicide headache. It hurts so bad that people just want to kill themselves and sometimes do. So if you're going to treat trigeminal neuralgia, um, release all the scars in the body, treat the low back because the balance of the pelvis and hips affects the neck. Then you got to treat the neck because the trigeminal nerve is one of the cranial nerves, so it comes out back here. So you got to treat all this. And then specifically, you want to go down to the foot and treat a point called stomach 44, which is a water point. The stomach meridian runs up and horseshoes the face. Water puts out fire. So if you use water points, you can put out fire. Definitely look at the stomach meridian, but look at an acupuncture chart. Any other meridians that run through the area where the person's having problems, just Google up water points for whatever meridian, and you can find them online. There are tons of resources. But it can be quite effective for trigeminal neuralgia and is one of the few things I've ever seen that can affect it. Let's see. Can you mentioned not touching the carotid. I saw lateral neck release protocol. Does that avoid the carotid? Yeah, it does. You know, again, it's not the electricity, it's the pressure. Like, you don't even do manual pressure over the carotid artery, so you don't want to stick sharp things in the carotid artery. But the lateral neck release gets into the scalene muscles, and you can treat in front of it along the sternocleidomastoid muscle. Just don't go right over the carotid. For migraines, will the protocol be the same as that for headaches? Okay, if you have migraine headaches, so migraines are vascular. So remember, we talked about these points on the fingers and toes that are emergency points, Jing, Jingwell, or Ting points. There's a point on the inside of the, I'm going to use a screwdriver here to point out to you, but on the nail on the inside corner right here, there's a point there called heart 9. So if you look up H9, it is used mostly for heart attacks and and strokes, because both of those are vascular, but migraines are vascular too. This is a really good point for migraine headaches. In addition to that, you're going to want to treat a point on the foot called gallbladder 41, which is a wind point, and migraines are a wind syndrome in acupuncture. They appear rapidly. And then you would want to treat the parasympathetic calming points. And a lot of people find that if they do vagus nerve stimulation for about 10, 15 minutes, it just takes the migraine away. So that's an easy way to cope with it. But there are specific acupuncture points that treat migraine headaches. And I treat a lot of them when I was working in neurology. And this is a very effective modality for that, for dumbing it, for numbing it down a bit, and sometimes getting rid of the headaches completely. Now, if you want to stop the patient from having migraine headaches, you're going to need to be a little more proactive. You're going to need to release the scars. You're going to need to treat the neck. You're going to need to do vagus nerve stimulation. You got to look at their diet and environmental factors too. But definitely you can have a very strong effect on migraine headaches. Well, it looks like that is all the questions I have down here. Does anybody want to ask any questions? Like, does anybody need to unmute their microphone and ask a question that way? We've got a few minutes left. You guys good? Okay.
Here I am.
Oh, okay.
Question.
Yes.
So I had COVID twice, basically just bad colds. And I worked in a senior's home for 9 months during the first part of COVID.
Okay.
And wearing the masks and all that kind of stuff, I feel that it's affected my breathing.
Mhm.
And it has affected my breathing in some way. So I've done every darn test there is, and they don't know what it is. So I'm assuming it is a long COVID effect. So that's the reason I bought this, was because no medical test can tell me what's wrong.
Right.
So I'm hoping that using the lung portion, that's going to help sort out.
I would definitely do a lot of vagus nerve stimulation for that.
Okay.
So even though COVID may not seem to have been bad for you, it still produces spike proteins, and spike proteins are pathogenic. Like anything they touch, they can cause problems. Your heart, you heard all about those weird blood clots. And unfortunately, what they found with the vaccines, with the mRNA vaccines, is they assumed it was going to stay in one place when they did the vaccines, and it was going to make your body produce spike proteins right there. But there was a couple of studies in Japan that found out that actually the spike proteins do circulate through your system, and your body continues to produce, if you've had the vaccine, continues to produce spike proteins for quite some time afterwards. So that can be a contributing factor as well. So you could potentially have problems from either the vaccine or COVID or both.
I chose.
Yeah. So I would say probably it would, even though you didn't have a bad case of COVID, it can still cause problems. Remember, there was a segment of like men like 18 to 22 or something like that who had like heart inflammation. Well, it's not just them. You know, that can be all of us. So I would just do a fair amount of vagus nerve stimulation.
Okay.
Anybody else?
Go ahead. And just build it up to, like you said, 5 minutes a day, and then
I would just say 5 minutes a day, and just kind of monitor. If you find that you are very lethargic the next morning when you wake up, I would either try doing positive polarity on the right hand side, or I would just back it down a little bit. And I would do it. I would, considering in your case, I mean, I'm not a doctor, but how about this? If it were me, I would be doing vagus nerve stimulation every day until I felt better.
Okay.
And if you did it for like a month or whatever and you didn't feel any better, I would consult. I would call the company and talk to Dr. Bruce or something like that and see what else you can do, because the parasympathetic calming points on the wrist, some of those are lung points, so those are good points to treat, and some of these
Okay.
are heart points, which are also good points to treat. So, and this device was approved for COVID. I think that certification is run out on it, but like the previous version of this used to say COVID recovery manual, but it can't say that now. So if you
Yeah,
follow
that's the one.
here, that puts you in a pretty good place.
Okay, awesome. Thank you very much.
You are very welcome. I was reading the book about manually resetting the sacrum. Is it possible to mess this up? I'm not confident on how to see it's truly off or not. No, you can't really screw it up. You're not going to mess anybody up by doing the manual reset. Okay, if my daughter is double jointed, is this and possibly Ehler Danlos, do I use the same polarity? Very good question. People with Ehler Danlos tend to have very loose ligaments, and their muscles are doing all the work. So they tend to have a lot of discomfort from that. So if somebody has Ehler Danlos, generally speaking, you're instead of using a negative polarity, you're going to use a positive polarity because they are actually deficient. Like things aren't tight enough there. So for people who are double jointed, yeah, use a positive polarity. That's what I would start with. Now, if they were having an asthma attack or a migraine or something, I would use negative polarity. But any joint related or back related pains, I would definitely use the positive polarity on them first to see what happens. What else have we got here? Manual states C1 through C7 and lower lumbar parasympathetic. So I would need to use positive polarity on the neck and lumbar. Yes, you would want to use if somebody had Ehler Danlos, you would want to use positive polarity on both of those. It doesn't matter whether they are sympathetic or parasympathetic. Oh, wait a minute. Are you talking about for Ehler? Yeah, for Ehler Danlos, I would assume. Yeah. Let's see what else we got here.
I have a
Oh,
question.
for a normal person. Actually, no. On the neck and back, you're going to use the negative polarity. Unless your patient is much, much older and is very deficient, like if things aren't strong enough, I would use positive then. But other than that, if you kept this on negative, 95 to 98% of the time, that would be all you needed. But there are some specific times where positive, and if you get the polarity wrong, you're not going to hurt somebody. You might piss off their condition a little bit, but you're not going to, it's not like you're going to put them into orbit or, and if you treat a point and it makes something hurt a little bit more, well, you have the right point. Clearly it's affecting that area. You have just chosen the wrong polarity. So if you just switch the polarity and treat the same point again, it reverses it. So it's a very safe modality to, I don't want to say experiment with, but it's a very safe modality to use because you can't screw it up too badly. Aside from, poking somebody's eye out with one of these, I would stay away from trying to do that. All right. Well, that looks like all the questions, and we are.
No, Joe, I have a question. I don't have a
Yes.
keyboard, so I have to.
Okay. What's your question?
When I treat a scar on myself, can
Yes.
I use the VNS after it, before it, both?
I would probably use the VNS after it. So you're going to release a scar and then use the VNS to further reset your system. So treating the scar is going to take the stress off your autonomic nervous system and allow it to slowly return to where it needs to be. But doing the VNS is actually going to kind of kick that into high gear. So you couldn't really get it wrong, but having done this for a while, I would say the best thing you could do is treat the scar first and then do VNS afterwards. Or you don't have to do VNS afterwards, but I would think it would be a useful thing. And if you're a manual therapist, you could put vagus nerve stimulation on your patient and do a treatment and do a manual therapy treatment at the same time. Because remember, I mean, we think that massage reduces stress. It doesn't. It actually stresses your body. Like mathematically, it stresses your body. That doesn't mean it doesn't work. Massage works quite well. But so if you do something like vagus nerve stimulation while you're doing massage, it accentuates the effects of it. it keeps your body from having that stress reaction from being touched. And that's even with light massage, that it stretches your system a bit. So it's a useful tool to use for that. Other questions?
Then I have another one about the VNS treatment.
Sure.
I'm not real clear about the difference between, say, using your left ear and doing both. I thought doing both was supposed to just calm things down in general.
It does. It's so doing the left ear brings things down. That's definitely for bringing things down. Using the right ear is definitely for bringing things up. Using both is more to try and balance things out. So I would say that using both is a little more for fine tuning. I guess that's a good way to put it. And I've even gone so far as to like attach electrodes to like headphones and try and set those up in the ear and stuff like that. And I find it can be useful for certain people. And again, the vagus nerve is a little bit of a finicky thing in that it responds a little differently on everybody. That's why we give you a couple of different locations to put the ear clips, and we give you a couple of different locations to put the electrodes, and you need to try those out and see how you feel. Other questions? Okay. Well, we are at 9:06. So tomorrow, look for an email from us, and that will be your invitation to join the Facebook forum. And there will be a link so you can go back and watch this. You can always sign up for this again and take it over again. I might be wearing a different color shirt, and I might say things a little bit differently. But I will be here. I do these every couple of weeks. More than happy to have you guys join me. So please do come back. I do need to go home and